This program is made possible in part by Cerisi Conlon LLP, protecting the future and using the law as a force for good in both the courtroom and our communities. Online at cerisiconlon.com.
Hello and welcome. I'm glad you could be with me tonight. I have a guest who's going to talk about a topic that I think most of us are thinking a lot about. Some of us are worrying a lot about it. We're going to talk about children and mental health tonight. And my guest is Emily Benson, who is a licensed independent clinical social worker. The clinical part is key. She has a wonderful center in Edina called Beginnings and Beyond. And she founded this center. She is a lead therapist there and has 6 or 7 other people, right,
7,
working with you.
That's right.
Just a few more things about Emily. She's had a really wide and extensive career so far, working with all kinds of people, all kinds of ages, medical social work, working with the indigenous community here in the Twin Cities. And so it's the perfect night to have Emily on to talk about this big topic, I think. Well, welcome officially.
Thank you, Mary. Pleasure
And
to
I'm
be
so
here.
glad you could come down. I want to start out with a big question, and I think it's on a lot of people's minds, and that is, why do you think our kids are having what seems to be like more mental health problems than before? And I don't mean just since the pandemic.
Right.
I know that has made things worse, but even before, I think we've just had a big uptick in mental health kinds of concerns.
It's a great question, and when I think about that question, I think about why are adults having more, and I think, we live in somewhat of a pressure cooker at times, right? And I think that the same things that are difficult for adults are difficult for children. We live a fast pace in our society. There's a lot of pressure on us. Kids are affected by politics like we are. Even before COVID, there was a lot of stress in our society. I think giving you information from what I've heard from my own clients who are teens and young children is probably most helpful. And what I hear the most is bullying is a big one that's caused a lot of mental health issues for kids that I see. Academic pressure is another one, and I see a lot of kids overscheduled. I see a lot of kids who don't have much time to let down.
To just
and
be kids, probably.
Yep, just be kids and just play and experiment with the world and be themselves.
So those are all things that make a lot of sense. The overscheduling, feeling the stress of their elders, their parents, their family.
Yeah.
Pressure to achieve maybe more than we had before. So kids are definitely hurting, aren't they?
They are, and if you think about some of the things that I named, they're things that I think adults feel as well, and what you bring up is definitely true, which is, parental stress is going to come down onto children as well, right? So the more we take care of ourselves as parents, the better our kids are going to be, right?
That's a wonderful message to take away from this half hour, Emily.
Yeah.
So take care of yourself first, as the airlines always say, hook yourself up to the oxygen, right?
That's right, because they feel our energy and they see how we take care of ourselves. And That's particularly true, I think, with mental health as well. You know, if we normalize getting therapy, if we normalize that it's okay to go and get help from someone, then they see that that's okay too.
What are the, using the clinical word diagnoses, what are the diagnoses that you see are causing parents to get help more than others right now?
You know, we see a wide range of diagnoses in our clinic. I would say that anxiety has been a little bit on the uptick, which isn't surprising based on what we've named. We see a lot of trauma in our clinic. We specialize in trauma, so that can be shock trauma, so big events that, you know, would be familiar, like fires or abuse of certain kinds. We also see children who have experienced, you know, grief and loss or divorce or adjustment issues and things like that. So it really runs the gamut. ADHD. I have some opinions on that diagnosis. I don't know if you want to go into that, but you know, sometimes ADHD can be trauma in disguise.
Oh, interesting.
Yeah.
I've heard, in particular, I have heard a lot of friends and family getting diagnoses of ADHD more than ever before.
Yeah.
Do you think, Emily, back when you were a little girl and going way back to when I was a little girl, were our parents just a little oblivious to our mental health, or do you think the stress of the times has caused this huge difference?
I actually think that parenting now is at times a contributor to mental health issues, meaning there's a lot of helicopter parenting. You know, I'm guilty as charged at times. You know, you worry about your child. We have different things happening in our society that weren't happening, I think, when we were younger in terms of safety issues with children. You know, when we don't allow kids to take a little bit more of a risk, or we don't give them the freedoms that they need to explore the world and be who they want to be, and we're telling them to be careful all the time and watch out and look out, that creates anxiety in their nervous system, right?
Sure.
So I think it's sort of that ripple effect or that circular effect, right? We worry about them and then they get worried, and it's kind of this little bit of a cycle, right?
Yeah.
Does that make sense?
That really makes sense.
Yeah.
If a parent is watching now who is saying, I don't know if my child would benefit from seeing a therapist, what would be some of the sort of most worrisome, most common things that would be red flags that parents would say, oh boy, this needs someone more than my looking at this to help to decide what to do?
Yeah. I mean, that's a great question too, and that's very age dependent, right? So I'll get calls, you know, about children who are maybe toddlers, or I call them the littles, you know, 5 and under, and they might have a behavior that's actually really developmentally appropriate. And, you know, we might talk about that's appropriate for their age, or does that, you know, kind of stand out as outside of what they maybe should be experiencing or exhibiting at this particular time in their life. So it depends on the age. I would say that good markers for that are just a change in affect. You know, if your child starts to look more sad or withdrawn, a change in their grades, less interest in things that they used to be interested in. So kind of the same signs that you would see in an adult. You know, if they start to experience depression or anxiety, those are the same things you're going to see in a child.
Change in mood, change in behavior. What about friendship problems? Is that a symptom, or is that a result of behavioral stuff, do you think? You know, sometimes kids are feeling alienated from their peers, and that's a very painful thing.
Well, growing up is difficult, you know. Peer relationships are difficult. I guess I'm not sure how to answer that in terms of whether or not a child struggles with social skills, or if there's, bullying going on, or what the situation might
So
be. I
each
think it's
case
really independent on
would
what,
be, yeah.
on what's happening in that child's environment and in their life.
But the key things then would be things like withdrawal or more sadness exhibited,
Yeah.
change in eating. I don't think you mentioned that,
Yep,
but
that
would
could
that
be
one?
that could be one as well. I mean, I think the overarching thought that I have on this is trying to connect with your kids even daily, if it's 1 to 2 minutes, so that you are aware and noticing changes in them, regardless of their age. My son's going to be 14 in October, and so sometimes I'll send him a little text message, because that's that's the mode of communication right now that works best for him. And so you meet them where they're at, and that's a great way to connect with a teen, or FaceTime them, or do something that they're interested in or they want to do, and meet them where they are, and just keep a pulse on where they're at.
One of the things that I mentioned to you earlier that people ask me about, knowing that I'm a social worker, one of the things people say is, Mary, how can I find a good therapist for my child, or a place to go? And that's a hard question, because, well, how do you answer that when people ask you for a referral to another center or somewhere? I mean, you can say, well, come to see our therapist, but for the general person out there, what's the best way to find a therapist?
Well, if you're talking children's mental health, unfortunately, you're lucky if you find one right now,
There aren't
because
enough.
the demand is definitely
Pacing?
Yes,
or-
outpacing the supply. Fit is always the most important thing in any therapy. So if you don't feel like you fit with the therapist, if the energy isn't there, if you feel like you don't trust your therapist, it's not the right therapist for you. And that's
So
true.
don't keep.
That's true
Don't
for a
stick
child.
with it.
No, that's true for a child. That's true for a teen. That's true for an adult. That's my belief. The relationship is the basis of healing.
Well,
And so try some out. It's okay to not like the first one that you meet.
can you call a therapist up and say, I've gotten your name from a friend, could we talk on the phone? Is that a common thing people do nowadays?
It really varies by therapist. It kind of depends on how long the therapist has been around and how busy they are. Most would do a 10 or 15 minute consultation, I think, if you
Okay.
ask them to, but I can't speak for all therapists.
Sure, sure.
But, I just want to add that there's a wonderful website called Psychology Today, and people's profiles are on there, and I find it really helpful when people put their bios up, because sometimes you can just get an essence of who someone is by what they write about themselves, and that's really helpful.
Emily, when kids have therapy, are the parents usually able to watch from a double kind of window, or are they brought in after a few sessions to meet with the therapist? What's kind of the common pattern?
I think play therapists, again, vary in how they work. The bulk of the play therapists in my clinic do meet with parents every time, because
Oh, they do?
Yeah, we have a belief that the relationship with the parents is just as important as the relationship with the child.
So they meet with the child first and
Yes.
then with the parent?
That's
And would the parent come in to join the child and the therapist, or separate?
No, we call it a debrief. So we do the play therapy session with the child, and then the child has a little bit of quiet time afterwards, sometimes a little snack to re-regulate, and then we'll meet with the parent just to kind of talk about some themes that came up in the play, and how the
okay.
week went, and some
I
parent
would like that
coaching.
as the parent, I think.
Yeah, it's really nice, and it builds the relationship with the parent too.
I bet. Now, you've used the word play therapy, and I don't know that we've defined that
Yeah.
yet, but do you want to quickly define that?
Yeah, I mean, in its simplest terms, the language of children is play. That's how they tell us about their inner world. That's how they tell us what's happening with them emotionally. And so a therapeutic playroom is filled with lots of different items that hold therapeutic meaning, that we're trained to know what they mean. And, you know, play therapy can be directive or non-directive. We do a lot of non-directive in my clinic.
Which would mean, in layman's terms?
Yeah, in layman's terms, it means a child comes in and we just innately believe that they know where they need to go for their healing. So they lead the play and we follow. And
So
we just,
they're leading, in
Yes,
other
that's
words.
right.
Yeah.
Yeah.
Ah, okay.
Yeah.
So you're, as the therapist, getting your cues from the child.
That's right. And then we're, you know, giving therapeutic responses based on their play, but it's not our agenda, it's their agenda, which allows them to heal at their own pace and allows their nervous system to build capacity for the issues that they're going to start to work with.
I didn't ask you this ahead of time, but can you give us like just a typical example, just brief one, of following a child and then doing some work in a therapeutic way with that child?
Sure. For example, like a first session.
Okay.
Yeah, so a child might walk into the playroom, and the first thing I would tell them, and this is kind of the hook, I would tell a child, you know, this is a place that's just for you, and in this room there are no rules, and you get to decide what happens, and I clean up at the end. And they kind of look at me like I have, you know, 3 heads, and there's no other space in the world that a child's going to hear that they have all the power and control. And that's part of what allows them to sort of let their guard down and start to play and show me what's happening inside for them.
And you don't do the cleanup song, clean up, clean up.
That's right.
Everybody.
They think it's the greatest thing in the world, and then the parents are like, oh, great, now my kid doesn't clean up. you know?
Right. Oh, gosh. Well, so that's a good example, though. The child is feeling, I bet, quite puffed up
Empowered.
at
Oh,
that
yeah, they
point.
look like little roosters sometimes. They're
Yeah,
like, this
I
place
bet.
is awesome. I'm coming back, you know?
And so, but what, as a therapist, are you getting from the child's reaction then?
I'm not necessarily getting anything. I'm helping the child feel empowered. And when you
okay.
feel empowered, you're able to start moving into some deeper pain. You're starting to work through whatever trauma is in there that you haven't been able to go to, but you're doing it in your primary language. You know, kids don't have a prefrontal cortex like you and I have that we're using to talk back and forth the way that we are. So I personally think that putting kids on a couch across from an adult is a major disservice, because that's not how they communicate what
It'd
they're
be
feeling.
intimidating probably for
Yeah.
most kids, wouldn't it?
Yes, I mean,
Yeah.
play is their language, and so we want them to play, and we can use toys to help them heal.
Oh, that sounds exciting. What if your child is old enough to say and really be quite impactful about it? I do not want to go see that therapist. I don't want to do therapy. I don't want to see her or him.
I hear you. You really don't want to go. What do you think about this picture of this room? You know, that's how I'll sometimes hook kids in. Why don't you take a look at this room and then decide? Why don't you come play one time and then decide if you want to come back? I mean, that's just me personally in my experience of how it's gone when kids are resistant. It typically works. I've never had a kid not want to come back.
Oh, okay. So you've got things that hook them in.
Yeah.
But what if the parent gets this resistance
Yes.
before they even get to come to you?
Yes.
Is there
Well-
any tip for the parent?
Well, what is the age of the child, I guess I would say, because,
Okay.
you know, we're the parent and they're the child. And so if your child needs help, it's okay that there's some resistance sometimes, because
And
like
it's
I
okay
said,
to say, well,
yes, it's okay
this
to
is
have
the
a kid
plan.
a little bit resistant to that, because kids do need our guidance, and they do need us sometimes to make decisions for them if it's for their own good. So we would never push a child over threshold or traumatize them. But I mean, that's part of being a play therapist, is being able to sort of draw them in and get them excited about the process, you know? And that's what's so
Right,
beautiful
right.
about play therapy, is they want to come because they feel really honored.
Yeah, that makes sense. The schools nowadays, as we all know, are, you know, kind of overburdened and understaffed and
Yes.
maybe having to do more than just teachers should have to do. Do you have any tips for parents in terms of communicating your child's maybe need for more attention or your worry about your child's mental health and wanting to engage the teacher, although you know, probably most people know the teacher is already spread thin?
And that's a hard one because what you're naming is accurate, right? I mean, our schools don't have enough resources. We need more social workers. We need more therapists. I mean, I know quite a few play therapists who work in the schools and pull children from the classes, but we don't have enough. We work with school staff from our clinic. You know, oftentimes we'll call and give advice or ideas, but, you know, like you said, teachers are already working with IEPs and working with 504s and trying to manage mental health issues in the classroom, and it's a real issue.
So try to communicate, but maybe it's going to be hard.
Yeah, I mean, I think the assistance of a therapist helps. I think when we call and talk with a social worker or we relay, I have a really awesome packet that I send to teachers. It's about how do you deal with trauma in the classroom. And it's a really tangible way to support a child. And so that's a resource that I've sent to teachers. So
that's a neat thing,
yeah, it's
too.
really cool. And I know Fraser will come in, that's a local agency, and do some therapy in the schools. So as much as we can get them into the schools to work directly with the kids, I think that's helpful.
That's great. Is there a crucial age, Emily, that if you've got a child that maybe is sort of outside the norm in terms of his or her behavior, and you're somewhat worried, but not enough to maybe get into therapy or get your child into therapy, is there a crucial age that you think, boy, we better help this child before things get much worse? And I guess as I say this out loud, I'm thinking, well, of course it depends on the problem. But, you know, I've heard teachers say, if we can't reach kids by 3rd or 4th grade in terms of bringing them up into reading, it gets dangerous, kind of. Is there any age that you think we better really pay attention to mental health? And
I mean, earlier intervention is
the better.
That's always true across the board. I think with learning disabilities, with mental health, with anything like that. But also being a trauma therapist, I know that it's never too late to heal either. But if you're talking about a specific trauma, the closer to the trauma, the better. The sooner you get treatment, the better the outcome. So.
And again, if someone's just tuning in, you're using trauma tied into things that are out of the ordinary, though.
Not necessarily.
Oh, no?
I mean, trauma is really anything that comes at us too quickly that we can't get away from, that we can't fight back from. And it can, you know, we kind of define trauma as a small T or a big T. Most people think of trauma as wars and fires and, you know, these big catastrophic things. But if you're getting bullied every day at school over the course of a year, that has the impact of a big trauma on your nervous system. So little traumas equal big traumas over time. So
pay attention to the little t as well as the big T. Yeah,
that's
I like
exactly
that.
Right.
Parents getting involved versus not. I mean, you said earlier, but could you speak a little bit more about the importance? What if one parent is willing to do the work and the other one isn't? Or maybe there isn't another one. Should you bring in a grandmother or an uncle or a neighbor?
Well, that's not an uncommon dynamic, that, you know, one parent might have some buy-in and the other not. That's actually a barrier sometimes too. One parent wants a child to have therapy and the other one is, you know, not willing to have the child go to therapy, and we can't see that child then because both parents have to consent to treatment in the state of Minnesota. So that's a really difficult situation for us. You know, I'm of the philosophy that any treatment is great treatment, and anyone that makes a difference in a child's life is important. So if one person is there helping, that's awesome. If they can't get therapy, That might be a teacher, a coach, somebody who's invested in that child's life is going to make a difference. We know that. It takes one person. So if they can't access the mental health, I recommend that they seek out, just someone else that's available to support them. There's a school counselor, a neighbor. It can be anybody. If you think about your own childhood, there's probably somebody that you think about that made a difference.
Right.
And it probably wasn't a therapist.
Right. Probably
right?
not. Yeah, you're right.
And who made you feel really special. Yeah.
All the things you're saying make so much sense. We're almost out of time. Literally, we've got about 2 minutes.
Yeah.
You brought some good ideas for resources. But first, would you, and we'll put this up on the computer screen later, would you give us the website for your center?
Sure. It's beginningsandbeyond.com, or beginningsandbeyondmn.com, and also playtherapyminnesota.com. Either one of those will get you to our website.
Get them to you.
Yes.
And as you said earlier, you've got several people working with you, so
Yes.
you can't always probably see people who call, but
we're a
good
facility
person.
that stays really busy. We oftentimes we're full, but we do have a really cool referral page. So when a clinician does have an opening, we'll put up who the clinician is, the day and the time that they have open, to try and make it convenient for parents to try and find a slot with us. And we're an insurance-based practice. We're really social justice oriented and believe, in access for everybody. So we do take insurance.
Oh, good.
Yeah.
We've got less than a minute, but the other 2 resources, tell us what you'd recommend.
I picked a couple that I think are helpful for both age ranges. So Trauma Proofing Your Child by Peter Levine is a wonderful book just to sort of help prepare your child for things that come at them through life and how you deal with them after they experience them. And then Gabor Mate is one of my heroes in developmental trauma, and it's called Hold On to Your Kids, and it's about staying connected with your teens and
with your teens in particular.
Yes, your teenage children.
Okay. Hold on to your kids. Oh, I like the title.
Yeah.
Well, thank you, Emily, so
You're
much for coming
Thank you so
down.
much
It
for
was
having me, Mary.
great
It's
to
a
have you
pleasure.
here, and so much wisdom to
thank
absorb here, and I'm sure people found it really, or will find it really, really helpful. So thank you.
Thank you for having me.
Thank you for joining Emily and myself. I hope you have a good week, and check out her website if you are really thinking that you'd like to get more help for your child or a friend's child. I'll see you next week.